So Bumby's Trill Burger, pickle pizza on a stick, and a deep fried BLT. Those are some of the winners at the Gold Buckle Foodie Awards at Rodeo Houston. Carnival food is a unique genre that many people get just once a year. For my next guest, this year really was the first rodeo for him and his wife. As a periodontist, Dr. Michel Azer knows a lot of us take eating various foods for granted. For many of his patients, like Jason Core, biting into an average meal was either too painful, impossible because of missing teeth, or he was afraid of losing another tooth. After going to Texas Dental Implant Center, Dr. Azer was able to restore form and function, meaning Jason has a beautiful smile now, and he can now eat whatever he wants. Good morning, gentlemen.
Hey, good morning. Good morning.
All right, you got to go to the cook-off?
Yes.
All right, what was the first thing that you bit into that you said, yeah, I didn't have this for a long time?
An apple.
Just an apple.
Of all things,
yeah.
right.
Yeah. All right, Dr. Azer, when people go to a dentist, sometimes we just kind of blanket it as dentist, but there's another level of training you go through when you are a periodontist and you do implants.
Yeah, correct. So that's my training. So after graduating dental school, we went to a 3-year program where we specialize mainly in dental implants and bone surgery.
Yeah.
And that's where I am, and this is what I love to do daily, to be able to help patients to get their implants done.
And those implants are a game changer now, because before, for a long time, all we had was the dentures, but there were problems with those. They would slip or you would continue to lose bone. Implants is the best thing next to having your own teeth.
Correct, yeah. So most of our patients that come to the office, basically they've been avoiding dentists for a very long time. I think the number one reason why people avoid going to the dentist is fear of the dentist or fear of unknown. And we've been trying to work on our systems to help these patients getting their smiles back. So we train our team to be able to understand where the patient is coming from, what levels of fear that they have, and be able to address that. We're using the latest technology, what we call a photogrammetry technology, and that cuts the treatment time to a very short time, and there's no need for additional visits.
Yeah.
And third, we do sedation or getting anesthesiologist inboard, so that way you can be sleeping for the procedure and just wake up to teeth.
Yeah, and Jason, you know, he talked about how people don't go back to the dentist after a while. I would imagine it got frustrating just chasing one thing after another, because you dealt with this almost lifelong.
Yes, ma'am.
When was
Absolutely.
the first time you realized you had problems with your teeth?
Oh, at a very young age. You know, some people are just blessed with good teeth. I wasn't. That, you know, it never really held me back. But the fact was that dental visits were painful. That hurt. Nobody likes the toothache, the pain that is associated with it, and that just kept me out for decades.
Yeah, yeah, and you would take pictures, like you said, nothing really held you back. You had a great personality, but you wouldn't smile.
That's absolutely correct. You know, and it just became habit where your lips just cover your teeth and you just look down. You know, it doesn't change who I am, but it certainly doesn't give you the level of confidence.
It doesn't change who you are, but people make judgments about you either when they see bad teeth or when you don't smile, I think, okay, well, this person's not friendly.
Right, absolutely.
All right.
Absolutely.
And Dr. Azer, like you said, this is the thing that you love to do, is because you give people back that confidence. When we say implants, I think a lot of us have the misconception that you're replacing every single tooth in the mouth. You don't have to do that. And it's not one size fits all. You look at the size of his mouth, his face, everything to make sure those teeth look like they were always his, but perfect.
Correct. And that's one thing that I was talking to Jason about before we start, is that everyone has a conception that the consult visit is a cookie cutter or everything is the same for every patient. What I basically told Jason on his consult visit is that I'm going to do the right thing for you. No matter how many implants I have to place, whether it's 4, 7, I'm just going to make sure that it's long-term successful and you're not going to regret doing it with me.
Yeah. And there are a lot of people who don't go into the dentist. We mentioned earlier, they're frustrated because they have gotten, you know, haven't gotten answers after visit after visit after visit, or it was painful. But there are others who feel embarrassed. You know, the crazy thing about teeth problems is sometimes they can sneak up on you, and so we don't go in until we feel pain, right? And then all of a sudden you go in and realize, oh, it's wow,
too bad.
Yeah,
already.
it's really bad.
Yeah.
But then, you know, the other thing is again, if you get it taken care of, this is one of those things that doesn't get better by ignoring it.
Correct. Yeah. So. Not only by pain levels, but also on social levels. I mean, speaking to Jason today, he can't stop taking selfies and taking pictures with us, and he's laughing about it. But I know on his first consult visit, it took us some time to get him to be able to show his teeth even. And now Jason is the same, but he's just like a more get-going Jason. He's happier to record his memories, taking pictures with his family, I think that's very important
Yeah,
as well.
yeah, we were joking about the fact that he's like photobombs other people's pictures. Like he shows up to other people's events and goes, "Did you want my picture?" Right. But then that's actually a show of that confidence that we talked about. And feeling comfortable in the office, that's something that's so important. When you went into his office, I know you make an effort of training your employees to say, here's the deal. When people come in here, they already are anxious, they're already scared, and so we want them to feel as comfortable as possible. What was that experience like for you?
I was terrified, literally terrified, and I had my assistant call ahead, make the appointment, so that when I went in, literally I was greeted with a hug. Every person from every level, and still when I go back for follow-ups now, treat me like I'm an 8-year-old and make sure that everything's okay and bring me water. And
Oh,
just,
but do you get to go to the treasure box and get a prize?
Absolutely. Here it is.
Yeah, there's your treasure box right there, is that smile. There are a lot of patients who have been told you don't have enough bone or been denied for whatever reason. This is another reason why going to somebody who is trained at the level that you are is so important, because you can do things that perhaps some other dentists might not be able to do.
Correct. After losing some bone, there's the areas where a regular implant would go is no longer available. And there are two ways to go back in there. Whether we graft it, grafting takes time, it takes over a year to restore the teeth, or we go to areas where the bone doesn't resorb. So these are like the cheekbones or so. And that's exactly what the consult goes. I sit down with the patient, I tell him, you lost bone here, but luckily we have training to do more advanced implants, and we're able to get you the result the same day as well.
Yeah, in fact, there are a lot of other dentists who will send their complicated cases to you. They're like, we know exactly where you need to go. One of the other things that stops people from going in to even check on it is how are they going to afford it? Come in, you will work with them.
Correct. So we do offer multiple financial plans to our patients, as well as we have our own lab in-house, and that helps me to reduce the cost of our overhead.
Yeah, because you're not going all over town with other third parties.
Exactly.
Yeah.
So cost is controlled by having the in-house lab, as well as there's no waiting time because the lab only serves our needs or our patients, so we don't have to wait for other clinicians to finish their work until our work starts.
Yeah. And Jason, for you, you're like, if you can't invest in yourself,
what can you do?
Yeah.
Right. And, and I think it's important to say it was new teeth the same day. You walk in, you walk out, great smile.
Yeah. All right. And your visits were reduced because it was all done under one roof. Okay, here we go. We're going to get a little picture right here. Okay, yeah. Oh, wait. Okay, yeah, get in and boom. There we go. The Texas Dental Implant Center has a special offer for Great Day viewers. Book an appointment within the next 2 hours and you will get a free 3D scan plus an in-person consultation with Dr. Azer. That's a $1,000 value, but you have to mention Great Day Houston and call within the next 2 hours to schedule an appointment. The number to call is 713-322-5056. Again, that's 713-322-5056. It only takes a minute to schedule your appointment, and it could be the appointment that transforms your bite, smile, and your life. To learn more about the Texas Dental Implant Center, visit bestdentalimplantshouston.com.